Hey everyone, welcome to the Eat to Win show where sports nutrition meets peak performance. Get ready for expert insights, real stories, and tips to help you win with every meal. Let's dive in.
All right, welcome to the Winner's Circle and the Eat to Win podcast. I'm Samuel Bullard, and today we are joined by one of the pillars of the secondary school athletic training community, Larry Cooper and Randy Cohen. Larry is a co-founder of the Excellence in Secondary School Athletic Training Certification Program and in 2021 Hall of Fame inductee. With more than 3 decades of experience, Larry is here to talk about elevating the role of secondary school athletic trainers and improving healthcare delivery in school sports. Let's jump in. So you've had an incredible career in athletic training. What inspired you to focus so much on your work in secondary school level, and then just kind of introduce yourself a little bit to our audience?
Yeah, thank you, Samuel, for having us today. We really appreciate that. I am Larry Cooper. I have close to 4 decades worth of athletic training experience at the secondary school level. I've been involved at the secondary school level, I think probably because I had just a great mentor that an experience in what we called our field experience. It was a tremendous individual, and he loved his job. He loved what he did, and it just rubbed off on me. And I really have no regrets in my career. I'm glad I stayed at the secondary school. And my coworker here, my partner in crime, my brother from another mother, Randy Cohen, is here. Randy, why don't you introduce yourself?
Yeah, my name's Randy Cohen. I'm an athletic trainer and a physical therapist, and I worked actually at the college setting for over 30 years. And Coop and I got to know each other really well. We kind of worked very symbiotically. I was the chair of the National Athletic Training Association Collegiate, Athletic Training Committee. At the same time, he was a secondary school athletic training committee. And what we found when we worked together is, we really, you had to kind of work together as those two settings to give the best possible healthcare to young people and to athletes. And we had a lot of things that we learned from each other and piggybacked from each other. And one thing that we had an advantage of in the college setting was really all these administrative tasks and understanding how to set up a healthcare system. And unfortunately, the veteran athletic trainers at the secondary school, like Coop, who we like to call him, Larry goes by Coop, to all his friends, and the young people didn't have that, and so we looked at what could we do to help improve that? What could we help to give the young people who are taking these jobs new out of school or just their first or second job and don't get overwhelmed? So that's why, we kind of really said, hey, what can we do to elevate the profession? So we decided to create the Excellence in Athletic Training programs along with Labiba Russo. And our first goal in that was the Excellence in Secondary School Athletic Training. And that's where we're at now. And that's what we're here to be really happy to talk about. So, Sam, thanks for having us.
Yeah. One thing I'd like to add there, and I think that the emphasis should be on experiential learning. And Randy kind of touch base on it. Everybody that we've had present for us has at least 25 years experience, boots on the ground, people that have done this before and had tremendous success at this. And that's why we're trying to help elevate the profession, not just at the secondary school level, but at every level by that experience.
Okay. So based on y'all's introduction there, I'm kind of curious, how did y'all end up working together? Because it sounds like you're in secondary school, you're in the collegiate setting. How did y'all end up start collaborating?
Well, again, like Randy said, I was chair of the secondary school committee for the NATA. He was chair of the collegiate athletic trainers committee for the NATA. And we did some collaboration there, and we started working. We were asked to collaborate on some projects with the NATA, and we have a very similar, I think, thought process. We look at things very similarly. And so we just, out of a conversation with Labiba Russo, she asked me who I thought would be a good person to work with, and it has similar ideals and ethics and things like that. And I immediately, the first person that came up was Randy Cohen.
There you go. Awesome. Okay, so why don't you tell us a little bit more about this program you've created? It sounds like you're trying to kind of almost take experienced athletic trainers and kind of teach them what they know about the next generation coming up. Can you go into a little more detail about how it's set up, what they get out of the program, like as they start walking through it, just kind of some basics?
Yeah, there's a couple different ways you can take courses. First of all, what we've done is we've secured sponsors so that we can provide CEUs for free. while it's live. If you are not unable to watch it while it's live, it costs $9.99 to go back into our academy and watch it. But what we've done the last 2 years, we've been working with the Board of Certification, and we've been working on a certificate credential, and it's with an exam. And Randy, you speak about this so eloquently, so I'll let you talk about that in just 1 second. But we've been working with them, and now we have 22 courses that we isolated as extremely important for elevating the knowledge and experience and success of a secondary school athletic trainer, and provided an exam. And we are starting that exam. We've had a few people already complete all of the 22 courses, are ready to take the exam, and it's something that should elevate their pay grade. We've spoke to a number of organizations that hire athletic trainers, and they've said that yes, if they get an extra credential, it will increase their salary as well. So, and I'll let Randy jump in here now.
Yeah, no, I would say, if you look at, athletic training is a healthcare profession, as is being a dietitian. It's a healthcare profession. And you look at other healthcare professions that are older and more established than athletic training, is you have these added certificates, these added credentials that you add on top of your normal education, your normal license requirement. What makes you a specialty in an area? And dietetics has that, right? You can be a sports specialist, right? We started talking about those years ago at the athletic training level, and we have one with the NATA, the orthopedics, but they also talked about adding other certificate programs and micro credentials. And we saw this gap. We saw this gap of we learn to be healthcare providers, but we don't really learn to be healthcare administrators. And we're asked, especially in a secondary school, but we are in a college setting too. But we're asked to be not only you are a healthcare provider, but you have to work in a healthcare system. But there's no system in place in a secondary school. They hand you the keys and say, here you go, you're running the whole program. And you go, okay, well, where's my medical record system? They go, well, I think it's in that file cabinet. Go figure it out. And then they say, well, what do we do for ordering supplies or maintaining credentialing or a policy and procedure for education or onboarding? And they go, I don't know. You have to figure that out. But we don't ask other healthcare professions to do that. And so what we saw a big gap in the education there, and we saw a big burnout, and you saw a lot of people leaving the secondary school setting very quickly and it wasn't because they weren't energetic and they didn't want to be there. It was a system that really wasn't set up for success for them. So we wanted to say, how can we set up a system of success for young people or even veteran people? Because Coop mentioned, young people. Well, really, honestly, it's veteran people. Are you keeping up with current standards? Are you keeping up with current things? Because when you're in the secondary school, it's easy to get busy in your job and not keep track of some of those things, honestly. And
the other thing we're seeing too is we're seeing people jump from the collegiate setting to the secondary school setting, and they're unsure of how to handle it. So all of these courses we've put together and packaged up is going to help them be successful.
And really, we're setting up a collaborative healthcare system in the secondary school, when part of a healthcare system is having collaboration with other healthcare providers. If you have a program, you need to have referrals for dietitians. You need to have access to mental health providers. You need to have access to physicians to refer to and people who can help you with rehabilitation, right? If you want to truly be a healthcare system to provide the best care, you can't do it by yourself. And so we need to have these collaboration. And how do you do that? How does a secondary school athletic trainer know how to, when they need help about nutrition and dietetics? What do they do? Where do they turn? So that's part of it. That's great. Thank you for having us here, because this is exactly what we're talking about, how to build a collaborative system to give the best possible care, because you can't do it yourself, and you need help, and you need to work as a team together. So
absolutely. I'm intrigued by kind of the difference between collegiate and secondary school, just kind of the way you're kind of thrown in there. So for someone who's like, I'm a dietitian, so from the outside looking in, compare and contrast the support that you would get at the collegiate level versus the secondary school. I know you kind of tapped into that, but for people who are not familiar, like, what is the difference in the situation?
Go ahead, Rick.
Well, it depends on the size in the setting of the collegiate setting. But if you look at the larger schools, you have team physicians right there with you. You have dietitians on board. You have a team of psychologists that work with you. You have a collaborative approach. When you're at the secondary school, you have yourself as a secondary school athletic trainer. Hopefully, we have a link to a team physician of some sort. A lot of times they only come on football Friday nights, Sometimes you have other relationships with them throughout the year. You have a school nurse. Hopefully you have some kind of mental health system within the schools, but you got to have that relationship with them and build it, or in the school district. And that's really what you have. And, as a secondary school, you are basically creating the whole system yourself, or running the whole system. Or in a secondary school, we can rely, or in the college, we can rely on other people. Now, smaller colleges, Division II, Division III, junior colleges, actually run very similar to the secondary school. So that's where the collaboration by Coop and I said, hey, there's not that much of a difference between the two settings. I have more resources, and even at different collegiate settings, it's how much resources you have. We work with Daryl Conway at Michigan, and he says, I work at Disneyland. I have everything I want. I turn around and I have somebody standing there who can help me. But that ain't the same thing at, Yavapai Community College. So they don't have any of those resources. They probably have the same resources that a small rural high school has. So yeah, there is a difference, but the difference is significant in some areas and not so significant in others.
Okay. So if I was going to simplify what the program is essentially just helping an athletic trainer navigate that environment where they don't have as robust of a system built around them already when they're entering into that arena.
Very good. Outstanding. But we're recording this, right? Because we can write this down.
Yeah, there you go. I won't charge you for that or anything.
Right.
Okay, and so as we're talking about that program, we're talking about this environment where there's essentially a vacuum of a system already in place when especially a young athletic trainer can come in there. So what are kind of some of the core skills that they're hoping to get out of the program in order to be able to fill that vacuum and start being able to build that system?
So we have 5 different categories. We have the business administration side of it, the clinical side of it. We have some roundtable discussions. We have safety, and then we have specialty topics. Now, in those, there's a lot of different topics. They range from nutrition. I wrote down a few of them here. I'm gonna read here. Improving the eating habits of the high school athlete. Nutrition and sleep guidance, the nutritional needs for the injured athlete, emergency action planning, mental health consideration, working with other providers, securing a team physician, how to document with limited time, showing your value, strategies and for developing and promoting the secondary school athletic training, onboarding a new staff, working with the school nurse, using the AT skill set to assist organizations and events, working with other providers, I said, who helps initiate positive change, how to direct policy change, and that's just a few. That's just the tip of the iceberg there.
And so each of those are going to be taught by someone who's been doing it for a long time, 20 years, about kind of how they learn to do this in an environment that may not have had the support when they started.
Yeah. For example, budgeting for success. That's one of the things we heard that a lot of people don't get any training, any education in that in their curriculum program. So we're trying to fill that gap and provide some insight on how to do proper budgeting.
Okay. And it sounds like you're really touching on also how just a very collaborative approach. So kind of how to talk to athletic directors and administrators and other school stakeholders as well.
Yes, absolutely. And one of the things that Randy touched base on is about the athletic administrator. And he can talk more about that because that was his role at Arizona. Randy, if you want to talk about that a little bit.
Yeah, if you look at one of the things is when you have a healthcare environment, you have to have a healthcare administrator, right? Who oversees all of your development of your policy and procedures and approval, and who decides how you cover things and what you do and all those medical administrative decisions. You have to have that. And, in the secondary school, your athletic trainer most of the time defaults to have to do that. But you have to have somebody who coordinates that overall. And that's a big role, and that's a big portion of the program. It's a much administrative duty. That's not how to be a healthcare provider. It's how to provide medical care in a secondary school environment. It's how do you provide that? And we have talks on some of the things that honestly this generation has a little struggle with. We know is how do you have those tough conversations? How do you have that conversation with somebody who is coming in, flailing and being all upset and mad about it? How do you calm them down, and how do you have that conversation to get them to understand what you're trying to do and how you're on the same page? Those type of things. And that's kind of the emphasis of the program. It's all those we used to call soft skills. We don't call soft skills anymore, but no, they are soft skills and administrative tasks, which helps you be a better medical provider or be able to be a successful medical provider.
A lot of athletic trainers aren't aware of what their role is in healthcare system. And so we have a very important part, and we have to learn how to work with everyone else in that system. And one of the things we talk about is ATs in today's healthcare system. And it helps them understand their role, how they can better provide athletic healthcare to their student athletes, and work within the system to provide optimal care.
And it sounds like you've already had some people go through the program, right? So do you have any kind of like success stories or feedback that you've gotten from people that have started to go through the system yet?
It's interesting. We've had, 55 courses in our academy. Last year alone, we had over 28,000 people register for our courses. But what's really interesting to me is we had an NATA Hall of Famer, and he has 45 years experience. And he's pulled me aside at numerous conventions. And he said, Larry, this is the best CEU program I've ever been through. He said, he used to work at the professional level. He's now working in his own clinic. And he said, I'm learning stuff that I never thought that I would. And he goes, I get fired up for every one of your classes. That's neat for me to hear, and I think Randy appreciates that as well. But what we're trying to do is this certificate program. We're trying to develop a way for people to get actual validation for all the education that they've received. And the test, once they complete it, they would be able to put, after their name, ESSAT-C for a certificate. And it should be something that they would be extremely proud of, because it is difficult. This is not something that you can just take it without going through all the courses. It's going to take a while. You're going to have to go through each course, which is 90 minutes, and actually go through, take the quiz, take notes, things like that. I spoke to a girl today who is getting ready to take our exam, and she's studying, and she says, Larry, she goes, I'm really excited about this. I've learned so much, but I'm taking this very serious because it's going to help me.
Mm-hmm.
Those are the things I like to hear.
It's not a weekend course. It's going to be, it's really, because it really gives you that added credential. It's one of the success stories that we haven't got the certificate yet, but we do have commitment from a big group of a conglomerate, a medical entity that hires a bunch of there's a group of athletic trainers that send out to secondary schools, and they already have commitment from their administration, just like they do for nurses and doctors and physical therapists. If somebody takes this certificate and gets the certificate, it will get them a raise. So it allows you to get more money because you showed that you put time and effort and commitment into yourself as a professional. You went out and learned a new skill set that you can bring to help their entity to provide better medical care. So they've already got commitment that if you take the certificate, once we're pretty much ready, we're validating it now, the test. And once that's done, they take the test and they become certified. They will then be able to use that as just like a nurse who gets a new credential, or a physical therapist or a doctor who gets something new skill, and goes and gets a certificate done. They can get get an increase of salary bump for it.
Yeah, it should help them negotiate. But also, I think most administrators, they don't understand the athletic training profession. So they're going to love it if the athletic trainer is taking on additional responsibility and taking away from things that they would normally have to do. So I think it's a win-win situation.
Yeah, I could definitely see why they see that value there, because they're kind of able to better connect and integrate with kind of the systems that they're put into. So I feel like we've touched on the administrative skill. We're kind of talking about like why that's important, but could you give like a real practical example for someone who's like looking from the outside in? Like, what's a practical example you've maybe had someone give you feedback on that this specific administrative skill was really valuable for me to learn?
I think the athletic healthcare administrator, and I'm going to let Randy answer this because it's much more involved than what most people think. Mm-hmm. Most people think that, you have to take notes, you take what they call SOAP notes, and you file them away, and that's it. That's not the case. Randy, if you want to go into that, some of the
nuance. I think change to make things safer. I think that's probably one of the big things that we've seen is the ability. We have a couple presentations on like analyzing your data and looking at it and bring that back to stakeholders to make things safer. So actually looking at your data and saying, hey, do you realize during this type of this season, this type of the season, we had more of these ankle injuries. Well, these ankle injuries were now you look back deeper in your data, and the ankle injuries occurred from one or two drills. So you brought that to the coaches and you say, hey, and you do it non-judgmental. You say, here's a trend I saw during this time of the year, during fall camp when we ran this drill. We lost three young men for over 3 weeks, each one of them. And they all were specifically doing on this drill. What can we do to make a change? And the coaches themselves said, well, what if we change the drill and do it this way instead of this way? What if we do this instead of this? What if we teach them this instead? And they start to, and then let them, you're empowering other people with data to make changes to make it more successful, because you're bringing information not saying you're hurting kids. You're bringing information saying, you lost players for 3-4 weeks, and then they're your better players. You lost your better with 3 good players, and you didn't have them for the first 3-4 games of the season. So how can we prevent that for next year? Those type of things, right? To kind of say, hey, what can we make changes that way? So some of those type of system changes from looking at your data and analyzing your records and bring information to the stakeholders who can actually make change is beneficial. It's been beneficial for people.
Those data-driven decisions. One of the other things too is oftentimes a secondary school athletic trainer is asked. A big ask of them is to host a tournament, maybe a Christmas basketball tournament, a wrestling tournament, something like that, soccer tournament. And really, they've never had any experience in getting healthcare lined up for multiple teams, hundreds and hundreds of participants. And so one of the courses we have is how to develop an emergency action plan and develop a plan for tournament and multiple venue experiences. So we have people that are dealing with volleyball tournaments with 64 teams. And we have them come on and share their experience on how they develop the medical side of it. And I think that right there is really, really important, because no one's ever taught that. In our experience in school, Randy, did you have anything on that?
No, and they don't have time in school. They're too busy in school now teaching. So you say, well, I want to learn this in school. Well, your answer is, well, they shouldn't teach you that in school, because they need to teach you how to be a medical provider and how to evaluate something correctly and how to rehab something correctly and how to assess. They don't have time to teach you these type of details. That's what advanced credentialing and advanced education is.
Absolutely. Okay. So kind of jumping over, I know we kind of touched on this a little bit, but so your system, I feel like is kind of we're trying to fill into that vacuum, right? What would be your ideal secondary school athletic care facility system? So we talked about how there's like a vacuum a lot of times, and like we're trying to help navigate that. If you could like design your ideal system that someone like you fresh in the field, they kind of came into secondary school, what does that ideal system look like?
Well, I think the system would incorporate a number of healthcare professionals. It would include, the team physician. It would include mental health experts. It would include a nutritionist. It would include a concussion specialist. Individuals like that. And you would also have an athletic healthcare administrator within the athletic training facility. So it could be me, it could be another coworker, another athletic trainer, it could be maybe an athletic secretary, it could be the school nurse, but someone that's responsible for those administrative duties so that I can really focus on patient care. And whether I'm working at the secondary school or the professional level or the clinic or whatever, the focus for us as athletic trainers should be on patient care. And we need to, in order for us to really provide that high level, elite level of care, you have to have all these other people in place to help us, that collaborative, because we all know that healthcare is patient-centered. And we have to do the same thing at the secondary school level. It's no different. And the secondary school athletic trainer has to understand that they have to run it like a business too, because they look at return on investment. The people that pay that salary, they're looking to see what they're doing, how they're doing it, when they're doing it. Are they interrupting academic time? Are they assisting with academic time? Are they providing an educational benefit to all the students, or just a few of the students. All those things we need to look at if you wanted to have that ideal secondary school athletic healthcare system.
And I look at it as I would want a system where you could automatically just plug in a new medical provider. You give them their job description, you give them their onboarding, what they do. They can step in and provide appropriate medical care and know how to do it, know what the expectations are from that school, know what the resources are, where they're at, how I do my job. So just like a secondary school athletic training facility or sports medicine facility should not be different than going into a hospital, where all of a sudden you walk into a hospital, you don't wonder how you're supposed to do the administrative portions of your job, or how you're supposed to contact somebody, or if you have an incident that occurs. Hey, is there an incident form I have to fill out? Who do I notify? And if something happens in the facility, who do I call to get this fixed? Or how do we get this fixed? Or how do we pay for something that's an emergent thing that we should never not have fixed? If I have an AED that breaks, how do I immediately get an AED within the next 24 hours? Because I have practices tomorrow. So how do I do that? You shouldn't have to figure that out as you're going along. That should be a system in place where you say, oh, you automatically contact the business office here. It's an emergency replacement. They know that you're going to call with an emergency replacement, and they know these 10 items are the only emergency replacements we have. Everything else can go out to bid or come on a budget cycle or things like that. But there's some things you can't do without. And they know that because the system's already set up. So no matter who's plugged into that system, if you as a new nutritionist brought in, you know what your description, your job is. You know what the expectation is. You know what the hours are. You know what your needs are. You know who to contact. If you meet with a young person, you say, wow, this person needs some more help. They need some mental health help because they're struggling. You know exactly who to contact because you've been taught, and it's not being learned as you're going along.
Yeah, absolutely. And it's not, so it sounds like what you're also touching on a little bit is kind of practical ways for athletic trainers to reduce liability.
Yes, Samuel. Ronnie told us you were sharp, but he doesn't realize how sharp you are, because, if you just getting an introduction into this program, you realize that you see where what we're trying to do is to help not only elevate the level of athletic healthcare, but also to make the job easier and better for the secondary school athletic training, reduce their liability. That's huge.
Yeah, absolutely. Because I was just thinking, because a lot of those situations you're describing, I was like, that sounds not ideal.
Yeah.
Yeah, absolutely. All right, well, stay with us as we take a short break to thank our sponsors. You're listening to the Eat to Win podcast with your host, Samuel Bullard. Liquid Fuel is a new sports and hydration product formulated by a sports dietitian to give athletes the edge to train and compete longer. It contains the low glycemic carbohydrate palinitose, designed to keep blood sugar levels more stable and to provide energy for 3 to 4 hours without the blood sugar crash seen in other leading sports drinks. Its unique 4-part electrolyte formula includes 50% of your daily magnesium to optimize muscle function. Liquid Fuel is naturally sweetened along with no artificial ingredients or colors. Currently being used by high school, collegiate, and professional teams, Liquid Fuel allows you to live your life with the confidence knowing that you're properly fueling your body. Visit drinkliquidfuel.com and use the code MSD10 to get 10% off your order. Welcome back to the Eat to Win podcast. We're here with Larry Cooper and Randy Cohen talking about athletic trainers in the secondary school environment. Let's continue. So we've been talking a lot about how the certification that y'all are putting forward covers definitely a lot of different areas. But could you talk briefly about how it's just very briefly, like if you were pitching it to someone, not an athletic trainer, maybe an administrator, how does it better show their value as an athletic trainer?
I think that there's 5 different areas prior to COVID that we looked at, and that was, like, do we reduce the number of injuries? Do we reduce the number of referrals? Do we reduce the number of ways that athletes miss practices, games, or events? The one is academic success is another one, and then insurance. So I think what we do as athletic trainers with all 5 of those, and then you add COVID, which is infection control and things like that. If you worry about all of those things, you are really showing your value as an athletic trainer, not only to your administration, but to your community, to your superintendent, your board, your school board, things like that. And I think it's, we we get so caught up in our jobs that we do not do that. We're so focused on, the game at hand, the injury at hand, things like that, that we forget about all the other incidentals that come along with it. So I think that what we're trying to do is let people understand or make note of what they're doing can really have an effect on the value that is provided to them, to their community. So
Yeah, absolutely. So, and that kind of briefly touched on, kind of what you were saying, showing your value there. What would be something you wish every administrator understood about like the impact that secondary school athletic trainer has?
I think that, a lot of people see us as providing water and ice. We are way, way, way more than that. I don't know if you've ever seen that picture of an iceberg, the tip of the iceberg out of the water and then everything underneath. And everything underneath people don't see. And that's, checking the weather, making sure that we're practicing in a safe environment. We're making sure that everyone has fulfilled all their requirements for a physical examination. We're taking SOAP notes and providing an opportunity for them to see a physician and following through with the physician's orders for rehabilitation and things like that. All of those things, I wish that the administrators would understand a little bit better. And I think through doing some of these things, they become more in tune to that. They're aware. The other thing too, with an administrator, we can take the liability off of them. If we develop an adequate policy and procedure manual, and we have a good job description, we can take a lot of the liability off of the school district. Randy and I have done a number of presentations on showing your value, and that's one of the things. We are stewards of the school that we work for, and they have to understand that we're never going to put someone in jeopardy and increase their liability, and they need to understand that. Randy has some great ways that he used to show that when he was in Arizona, but every administrator needs to realize that we're there to help them and reduce their liability.
Absolutely. And so it sounds like both of you all have served in a lot of different leadership roles, and you're definitely bringing that into kind of this program that you're preaching. Obviously, you're not the only ones doing the lessons, but in the continuing education. But what do you feel like through some of those leadership roles you're bringing into being able to put this program together? Like what kind of unique perspective does it give you when it came to designing this program, pulling from those leadership experiences?
I can speak for me. When you're in leadership, you hear a lot of things that maybe you weren't aware of before. You also have to take a, global view of things. And rather than how is it going to benefit me or how is it going to benefit you, you got to see how is it going to benefit everyone. And so I think that that perspective has helped me when we went and developed this curriculum. But you see what ways can we benefit everybody? Randy, anything you want to add?
Yeah, I would also add that, how can you get collaborative help and rely on other people? That's I think the most important thing. When I think that the biggest thing you truly learn in leadership is you can't do it yourself, and you have to rely on other people and empower them to make choices and guide them to make sure they have this, they know where the agendas are aligned. I think the best thing about great leadership is a very good psychologist friend I worked with years ago would always say is it's really easy to accomplish a lot when your agendas are all aligned. So a great leader aligns everybody's agenda. It's not about you. And when you're looking in healthcare and you're looking in, healthcare in general, no matter what it is, I always say, and it's not about me. It's about the patient. Everything we do is about the patients to help the patient. This isn't about my practice or they aren't, they're not my patients. They're our patients. We are patients we all work with. And we want to make sure we're doing right by them. And we mentioned liability, and the number one way to prevent liability issues is if you realize that it's all about them and you're doing what's best for the patient. That's the number one way to decrease liability. It's not, if you're focused purely on that, then you have very little liability because you've done what's best for that's best for the patient. And that's what we have to do. And we're working in a unique environment, because, everybody around us in high level sports and even not all sports. Sports, the number one thing in sport is to win, right? The number one most important thing is to win. Well, I don't know an athletic trainer who doesn't like winning. However, compromising the patient, the safety and well-being of the patient is always your first priority. Helping the team win is actually, from some of our education, it's number 3. Number 2 is to protecting your employer and all the employees. Our job is to do that. And the third thing is to do everything possible to help the athlete be successful on the field and to win. But you can't compromise 1 and 2 to get to number 3. It's not do everything possible to win. That's not what you have to have a check and balance. We always say that. You have to have a check and balance. Coaches have to have a check and balance. As administrators have to have a check and balance. And it's our job to be that check and balance.
Mm-hmm. Yeah, we are the student athlete's advocate. Sometimes we know better what they need than they know themselves. And, that's a unique part of our job, like Randy mentioned. We get to see the injury happen. We get to see, how it's cared for. We are part of that care. And then we get to see them return to something that they truly love. So we have a unique perspective. And I think that helps us. It really does.
We have a unique perspective in healthcare because we know our patients before they're actually patients.
Yeah.
That used to be the family practice doctor. They birthed the baby and they lived in the small town and they knew the kid the whole time growing up and knew him in school and da-da-da-da. Unfortunately, healthcare isn't that way anymore, right? You don't know the person until something's wrong, and that's not as easy to manage. And then you're trying to manage something instead of prevent something. And you'd much rather be foresight and be able to prevent things than it is to manage something once it occurs.
Yeah, that's a very interesting perspective to think about the way that's changed. But that's absolutely true. I did want to, as we're kind of rounding out this episode, I did kind of want to ask y'all, knowing what you know now, especially as you're developing this program, if you were going to talk to an athletic trainer, first job, they're coming into secondary school, what is the one piece of advice that you would give them right off the bat to help streamline a lot of the different issues and complexities that we just have described as we've been talking?
There's a couple things, really. I can't say one thing. But first off, they need to set boundaries. Just like any other profession, you have to create those boundaries. Otherwise, people are going to take advantage of you. That's number 1. Number 2 is you're going to fail. Hopefully nobody gets hurt because you failed at something you did, but make sure that you learn from those mistakes. Because if you don't learn from those mistakes, it was a mistake. It wasn't a learning situation. The third thing I would say is don't be afraid to ask, because I have 4 decades worth of experience. I still ask people about stuff. It could be a rehab program, it could be, return to play criteria, a new rehab protocol, something like that. But don't be afraid to ask. I know of no athletic trainer ever that I've talked to that would say, no, I'm not going to help you. Athletic trainers are very helpful and willing to share information to make the profession better.
And I would say develop relationships with people before you need them. Make sure that the relationships are transactional. You're helping them as much as they're helping you. Let them know what your agenda is. And so they try to find out what their agenda is, so you are aligned. So you make sure you know where they're coming from and they know where you're coming from. A great legendary athletic training friend of mine used to say to coaches, Coach, I gain nothing if you lose. I'm trying to cause you to lose games. I'm trying to help this young person who's in front of me who isn't able to play right now or isn't safe to be able to play or isn't ready to play. I don't gain anything if you lose. And if you have those conversations beforehand, they know where you're coming from and say, hey man, my job is to make sure someone's safe. If they're not safe, I'm gonna come and let you know. If the environment isn't safe, I'm not gonna come and let you go. I don't want to cancel practice, but if there's lightning on the field, we can't be out there. It's not safe. I don't get to go home early. I'm not excited. There's lightning. I get to go home early. I'm not trying to go home early. I'm trying to keep everybody safe. So that's why we're saying there's lightning. You need to leave the field. So, but have those relationships beforehand. So when you walk up to them on the field and say, we need to lead to lightning, they're not saying, who are you?
Yeah, right.
Make sure you have that relationship you know them beforehand.
Absolutely. Okay. And so if anyone is interested and they want to find out more, how can they find about your program, about your content, contact y'all? How do they get in contact with you?
Well, if you go to ebpcentral.com, Biba Russo, that's her company, and that's who our partner is. There is information on there about the ESSAT program. There's also information on there about ECAT, the Excellence in Collegiate Athletic Training, that Randy is spearheading and starting up right now. So, if you go to ebpcentral.com and you'll find more information, certainly we will get that information, but I can give you my email, and I'm sure Randy can give his email. Mine is coopatc1 at gmail. So coopatc1 at gmail.com.
And mine is rpcohen, COHEN, ATC @gmail.
Awesome. Well, thank you so much for coming on the show. I'm sure a lot of athletic trainers are going to find that very helpful. And honestly, as a dietitian too, I found it interesting because from the outside looking in, it's interesting to see the athletic trainer perspective for sure.
Samuel, thank you so much for having us on today. I appreciate the opportunity to get the word out about the program. Randy and Ronnie and Tavis have been a part of our curriculum. They've been presenters, and I'm sure they are experts in their field and certainly really added value to our program.
That wraps up another episode of the Eat to Win podcast. Big thank you to Larry and Randy. Be sure to check out their program and follow them for insights into improving healthcare delivery and professional growth in school athletics. If you enjoyed today's episode, don't forget to like, subscribe, and share. Until next time, keep winning.
Thanks for joining us on the Eat to Win show. Remember, every meal is a step toward victory. Until next time, stay strong and keep winning.